Lee Silsby has sponsored our breakfast. Although I think they have a really nice product, they're not paying me to tell you anything about that. And I'm really standing up here as a private physician who's trying to relay to you what goes on in my practice and how this product may or may not have benefited my personal patients. Curcumin or turmeric is used very widely as a nutritional supplement. I did a literature search, and you see that there's a vast amount of information on it as an anti-inflammatory. There's also a fair amount of literature on it being an anti-yeast agent. And what's interesting is it seems like the number of papers in that arena has really been growing over the last several years. And there's also a fair number of papers that are showing increases in glutathione levels, which should be helping with detoxification, which we all know is a pretty significant issue with many of our patients. Our study in adults, because there's a sort of standard titration of starting at 600 milligrams once a day and gradually increasing that to 600 milligrams 3 times a day. And certainly I'd like to see this redone in the children in my practice. We had instructions that if, let's say, at 600 milligrams once a day, all your pain resolved, you would just stop there. Or if you had a flare of your symptoms, maybe from yeast or detox or what have you, they were to call the office, and then we would, work them through that. But we could certainly, in a time of a flare, we would either keep the dose where it was or maybe even decrease it. The severity of back pain was reduced, from an average over the 7 people of 1.14 to 0.79 change in the amount of muscle pain, and how this was reduced with the same p-value. Reported that they had initial headaches and or some pretty significant moodiness and irritability that generally sort of went away within the first 2 weeks of the study. And so my question kind of is this sort of a yeast die-off reaction? Could it be a toxin shift? And so that was just sort of kind of neat to see that some of the other bits of the turmeric really are coming through. And the possibility for adverse effects, when looking through the literature are very small. Calling all the time, her back pain's been horrible, narcotics don't work, like nothing works for her. And if you don't fix her within 2 minutes after her leaving the office from any given office visit, you receive a phone call later that day. Says, I don't ever want to stop this stuff. She had a really dramatic decrease in the frequency of her back pain, for which she's had injections and all kinds of other things on top of her narcotics and her antimicrobial therapies. The take-home messages here are, that Enhansa has led to some pretty significant improvements, especially in lower extremity frequency of pain, as well as upper extremity frequency, and then back and muscle pain severity. Curcumin in general has been very well supported to be anti-inflammatory, antifungal, and also to increase glutathione in the literature. 85 or 90% of my patients get this covered by their insurance, so that's really been a nice benefit as well. So if anybody has any questions,